So today, we're going to be talking about lung cancer. If you're asking why,
it's because this video was inspired by Jack and Draco, who designed a new way to detect pancreatic cancer.
his test involved the detection of the protein MSLN, a biomarker for those with pancreatic cancer.
Inspired by Draco, I turned my eyes to the screening of lung cancer.
Let's start with the basics of how lung cancer begins. When the lungs are exposed to certain chemicals or elements, the cells are damaged. When this happens, the cells multiply without dying off, and this causes a tumor to form. Smokers aren't the only ones at risk for lung cancer. Radon is the usual culprit for lung cancers among non-smokers.
The reason we need to worry about radon causing lung cancer deaths is because the EPA estimates that radon causes at least 20,000 lung cancer deaths each year. Radon, having a relatively high atomic number, is radioactive, and the radiation coming from radon gas causes damage to the cells that make up lung tissue. So what is radon like? How can you identify that radon is nearby? Does it have a funny smell or a funny taste? Well,
No.
does something smell funny to you?
No, not at all.
Tastes just like air.
Of course it does.
So, who's at risk to this invisible danger? Miners are at risk because of the amount of time they spend underground.
If you're asking why,
It's because
radon comes from underground. The uranium ore that is in the Earth's crust goes through a decay chain that creates radon. The radon gas then seeps through the cracks and tiny spaces until it reaches the surface.
if you're just outside digging, that's completely fine. As long as you're not in a mine underground where the air is cut off, the radon will be diluted by the open air above you. So digging it with your shovel? Fine. But taking your pickaxe and digging underground puts you at a higher risk than other people who stay at home. Right?
Well, yes, but that doesn't mean that only miners are in danger. Because radon gas can seep through tiny cracks, it can enter people's homes. Breathing in high levels of radon can cause lung cancer because the bronchi are hit by radiation.
Currently, we diagnose lung cancer by x-rays of the chest. An early diagnosis is key to survival. However, many of the times that an early diagnosis is found, it's because the x-ray was done for a different reason. This is because the orthodox screening is costly, and doctors don't want to give the screening on solely suspicion. Another reason lung cancer is diagnosed too late is because of the symptoms of lung cancer.
Symptoms can vary from person to person, but they generally include coughing, chest pains, wheezing, and weakness.
Symptoms also include pain in the arms and elbow, as well as a loss of appetite. Coughing, shortness of breath, fatigue, all of these things are caused by things other than lung cancer. So most people don't rush to the conclusion that lung cancer is the problem. The second problem is the timing of the symptoms. The symptoms I've listed, they usually appear after the cancer is very advanced. Because an early diagnosis increases a good prognosis, the fact that these symptoms don't appear till late in the cancer stage means that most people that get lung cancer don't survive after more than 5 years. Which is why I'm trying to find a new way to screen patients for lung cancer.
The tubes in the lungs that air travels through, called bronchi, are lined with mucus.
When a person breathes, air can get trapped in the mucus lining. What this means is radon gas can mix in with the mucus in the lungs.
A sputum culture is the name for when mucus in the lungs is expelled through the mouth for testing. It is inexpensive because it is simply a patient coughing up phlegm.
Although it is with mucus that has been expelled from the body, the radon should still be giving off radiation.
This radiation can still be measured by a scintillation counter and a compound like sodium iodide. If the level of radiation is too high, then the patient will have or likely develop lung cancer. The patient would then need to be x-rayed by a computed tomography scan to locate the tumor. This pre-screening is needed because of doctors' reluctance to use CT scans due to their high cost.
With the affordable pre-screening, more people will be screened for lung cancer, but only those who are at risk for lung cancer will have the more expensive CT scans. What this will do is it will lower the number of people who get unnecessary scans. This will increase the accuracy of lung cancer screening. I have a plan to make this from merely something on paper into reality. This summer, I will be volunteering at the Erlanger Hospital near my home, where I'll meet many different doctors and physicians. I hope to get referrals from them to work at a laboratory to test my work and my theory.